With over 1 million members, we know what people can do when they come together. We are Rotary. We are people of action. Find out more at rotary.org/action.
Welcome to a special presentation from the Rotary Clubs of Jonesboro and West Little Rock. I'm Gary Higgins, President of the Rotary Club of Jonesboro. Rotary's motto is service above self. One way we serve is through outreach and education. This forum is a great way to share information during this pandemic. I'd like to thank District Governor Mike Benich for his support of these COVID-19 updates. I'd also like to recognize the outstanding contributions by Hatton Weeks, our host and moderator. Hatton is the Vice President and General Manager of KAIT TV and is a member of the Rotary Club of Jonesboro. We are fortunate that he shares his years of experience in news and media with Rotary. Thanks for your time, and please ask questions. We want this presentation to be interactive.
Hey there, my name is Doug Shackelford, and I am President of the Rotary Club of West Little Rock. Our club, just like all of the clubs around Rotary District 6150, are where neighbors and friends and problem solvers share ideas and join other leaders to take action to create lasting change. In our club, we are so fortunate to have Dr. Jennifer Dillahay as a member. Dr. Dillahay is the state epidemiologist with the Arkansas Department of Health. She is also our 2019-2020 West Little Rock Rotarian of the Year. Our state leaders continue to lean on her every day for expertise and guidance, especially during this unprecedented time of pandemic. We are privileged to have her in our club and for her willingness to share her knowledge with Rotarians and other civic organizations throughout Arkansas.
And good afternoon. My name is Hatton Weeks. I'm a member of the Rotary Club of Jonesboro. Thank you so much for joining us for this live presentation. We hope you are staying healthy wherever you're at. Before we go any further, I want to take a moment and ask for you to consider helping our friends along the Louisiana and Texas coasts as they deal with the aftermath of Hurricane Laura. And if you're watching in South Arkansas, we are hoping you're making it through, and I hope you make it through without any loss of life, property, or electricity. All right, back to today's conversation. After Dr. Dillahay goes through her presentation, now we left plenty of time for your questions. So please ask questions. You can do that now or as you think of them in the Facebook Live or the YouTube chat windows. We want this to be an interactive process. We'll get to as many questions as we possibly can, and it's okay to be specific about your specific club or project that you're working on. We just ask that you keep the questions relevant to today's topic. Now let's bring in Dr. Jennifer Dillahay with the Arkansas Department of Health. And Dr. Dillahay, good afternoon. And we have civic clubs tuned in wanting to know some best practices on one-on-one meeting or in-person meetings and on service projects that they may have in their community. So take it away.
Well, thank you, Hatton, and thank you all for having me on this presentation. I'm really happy that I can share some of the things I've learned and the work that we've done here at the health department to help Rotarians and other service organizations around the state. So I wanted to say that, we have to get a perspective on this pandemic. And part of the perspective that has helped me is to think of this pandemic as a long train ride. So I've put that as the theme of my presentation. So if we could start with the slides, that'd be a good time now. So as you see, the update today is about, it's going to be a long train ride. And so what I wanted to do is, see if I can, is just, frame this as, what we're dealing with. We're dealing with a new virus to the human race that's called SARS coronavirus 2 or SARS-CoV-2. And of course, the name of the disease that it calls is coronavirus disease 2019, but we call it COVID-19 for short. So where are we now? So this disease was first identified in China in December. And as of August this year, worldwide, we have well over 25 million cases of this disease and over 800 27,000 deaths in almost every country in the world. The situation in the U.S. is that we're closing in on 5,800,000 cases, and we have almost 179,000 deaths. So this really is having a huge impact on our country. In Arkansas, we have over 58,700 cases total. The active cases at this point in time are over 5,300. We're getting close to having 53,000 people who have recovered from this illness, but sadly, we've had 739 deaths and hundreds of people currently hospitalized for it. If you would like data about your county or your school district, you can go to the two websites here. I would like now to try to share those. So I'm going to see if I can put them up. So here is the Arkansas Department of Health website. If you go to this website and you just click right here, you'll come to the web page for COVID-19. And when you scroll down, you'll be able to see this button, and there's all kinds of information, data behind this button if you will click on it. There's also a new full list of reports that you can see here, and you can click on that. And then the Arkansas Center for Health Advancement, this is their home web page. And if you click here, let's see, you will be able to see data by community, school district, and by zip code. And this may be helpful for you to understand the situation a little bit more locally than you can at the county level. So I would like to go back to my presentation now. And part of my job at the health department has been to work with a team of physicians that we've nicknamed the PPG, which stands for the Pandemic Physicians Group. And together with other people who have specialized expertise, such as our environmental health specialists that inspect restaurants and people that investigate outbreaks and our food or water or all these things that people at the health department have expertise in, we have put together over 100 documents that provide guidance or directives about what they need to do in order to protect the people that they serve. So we used some of the information for the guidance documents to put together a draft for what could service organization clubs do in their meetings to minimize the risk of spreading COVID-19 at their meetings. And so I have about 5 slides here. I'm going to go through various points that clubs can do. And I hope you will be an active listener in this. And in the chat box, make comments, offer suggestions, ask questions so that the health department can improve this document, which is just a draft, to make it most useful for you and your organizations. I'm familiar with Rotary, of course, because I'm a Rotarian, and I have visited some Kiwanis clubs, but there may be other service organizations that operate somewhat differently. And so I want this document to be useful for them too. And so I really do need your input to make it as good as it can be. One of the questions, of course, has been, should we meet or should we just have remote meetings? Many clubs are switching to online platforms for the time being. And it could be that you would want to use the data in these websites that I've showed you to show, like, if there's a lot of cases currently in your school district, and by the school district, they're not just talking about the students, they're talking about everybody that lives in that school district, the whole community. And that's on the Arkansas Center for Health Improvement website. But the health department, we do county level. So if the spread in your community is high, you might want to consider holding off longer. So we are encouraging organizations to hold online meetings. And then if you decide to meet in person, we hope you will find a way to offer online platforms for those who choose not to attend. There may be some people who are higher risk for severe COVID-19 disease if they were to get infected. And this includes people who are over the age of 65, as well as people with chronic health conditions. So that's a consideration for you. That's also important, to make sure that people are aware of some of the dangers of COVID-19. And, I feel like I eat, breathe, and, drink COVID, all the time. That's all I think about. But there's a lot of people who still are confused and they don't know very much. They haven't been able to connect to good sources of news or information about it. So what we have asked or required in other situations is that people post a sign or they do a screening so that before people can come into a meeting, they do their temperature with these little scanners, the handheld things. You don't touch the person, you just put it in front of their forehead and you take someone's temperature. And anyone that has a temperature over 100.4 or higher, just doesn't come in. Or you can ask them to take their temperature at home and just not come if it's higher. We ask about cough, shortness of breath, difficulty breathing, new loss of taste and smell, which is one of the odd symptoms of COVID-19. And then if people have been exposed to someone with COVID-19 in the prior 14 days, they should be at home quarantining. So we remind people of that when we ask them before they enter work or, in this case, a meeting. And then to make sure people understand who's at highest risk and advise them to consider not coming into a meeting or out in public settings where there's a social gathering. And then the other thing, and this is going to be harder for certain venues, and so you have to think about, if people can stay at home, that gives you more room to distance. So the idea is for people to stay 6 feet from one another when they're at the meeting. So you can arrange the tables and the chairs in such a way that it's easy for people to be 6 feet from each other. Of course, a husband and wife coming together, people from the same household, they could sit together. But people who are not from the same household, they need to sit separately. And then places where you line up to enter, you want to either mark things on the floor so people stand 6 feet from each other. And you want to think about when people exit that they don't bunch up, so you can, and sometimes you have to be really directive to people until they get used to this. So one table is dismissed or a next section is dismissed so that they can, wait for those people to leave before they get up and leave also. And then, we've tried to practice this in the West Little Rock Rotary Club during flu season is, we don't shake hands when we greet one another. We have a little bow or an elbow bump or, a hand, friendly hands or just something to acknowledge that, but we don't hug or shake hands with people. And then we want to talk about face coverings. And face coverings are really, I would say, the most important strategy for reducing the spread. We know that COVID-19 is spread when people talk, when people sing, when people laugh, or they yell or cough or sneeze. So coughing and sneezing, people are more likely to give off a droplet that falls to the ground within maybe 3 feet them. But singing and sustained talking, the vibrations of the vocal cord create very small particle droplets that aren't heavy enough to fall out onto the ground. They'll stay in the air. And so the idea behind a cloth face covering is to block it. And so it needs to fit snugly around the face so there's not escape. And it blocks the aerosols and the droplets and reduces the spread. Sometimes people want to wear face shields, and face shields are helpful to keep someone from getting infected. The cloth face covering is to keep someone from spreading the infection. So if you wear both, that's a pretty good combination. But a face shield by itself is not sufficient. We want the cloth, the face coverings to have 2 layers. So if you're using one of these gaiters, which is kind of a neck, I don't know, and I call it a neck blanket, but it's like a tube you put over your head and it sits around your neck, and then you pull it up over your nose. It needs to be 2 layers to really work well. And same thing with bandanas. And you may see face masks out there that have a little valve in them that's for exhaling the air, and you definitely don't want to wear those. Those are almost worse than no mask at all, because it gives really a little focused jet stream of air that has the virus in it if you're infected. So you don't want to wear those at all. There are some exceptions when you can consider not wearing face coverings. That would be having the speaker, and you would want them to be 12 feet away rather than 6, because when you're speaking, you're talking loud, and the aerosol, you're making more aerosol and droplets. Of course, you need to take your face coverings off if you're eating at the meal. So you need to be thoughtful about getting up between, like if you're getting up to get a cup of coffee or something, you need to put it on in between. So just while you're eating and drinking, but putting your face mask on afterwards. And I know some Rotary clubs sing, and other clubs may as well. And I would encourage at this point in time, no singing. Do not sing at your Rotary clubs, please. You can play a recording of something, but don't sing, because it just makes too much aerosol, and it's just not worth the risk of transmitting the virus. And then you want to think about hand hygiene and make sure that you have sanitizer at the entrance and the exit. And you want to decrease the use of items that multiple people pick up and touch. I was thinking, sign-in sheets with pens. People need to bring their own pen if they're going to sign in, or you have one person sign people in as they arrive. Of course, sharing microphones is a problem. And some clubs have flags or things that they pass around or do things with. You need to think about what you do at your club and not do those things have those things that multiple people touch. And then, of course, there's a meal, and in some Rotary clubs, they dine in restaurants with buffets because that's a good way to serve the food quickly. And so the health department has been saying no buffets right now. And we're looking at that to see if maybe we're at a place where we can have buffets. And some restaurants are having buffets anyway. So if you encounter a buffet, multiple people pick up the spoons and the things to serve themselves. So I would recommend that if you come to a situation like that, you clean your hands before you serve yourself at the buffet so that you don't put your virus on the utensil. And then as soon as you are finished serving yourself, you clean your hands again so that you don't take whatever was on those utensils with you. And we also want them not to be so commonly served condiments or, cream pitchers that everybody picks up or pours or things. We're trying to minimize the things that lots of people touch. And so I want to now transition over to some opportunities for service. I know some of these guidelines I've talked about can be applied to how you do a service project. The distancing and hand sanitizers, you use a hand sanitizer when you go from one setting to another. But I really wanted to talk about something that I would like to ask Rotary clubs around the state to strongly consider. As you know, the Arkansas Department of Health operates at least one county health unit in every county in Arkansas. So we have 75 counties with 94 local health units. Some counties have more than one depending on the population. And every year, the health department has been providing flu vaccination to their communities. Usually they'll do a countywide vaccine effort. They may have one or more mass vaccination clinics that people would come to, and they would line up and all get their flu shots. Well, obviously you can't line up anywhere now to get a flu shot because that would spread COVID-19. So what we're planning to do this year is have drive-through influenza vaccination clinics at local health units and other locations around the state. And we're going to begin having those clinics on September 21st. And I hope I don't need to tell you how important it is this year, especially for everyone to get a flu shot. It's important because, well, first, you don't want COVID-19 and flu at the same time. But every year, influenza overtaxes the healthcare system in Arkansas. And right now it is already overtaxed with COVID-19 and other health conditions. So we don't want to add those together. So we want service organizations like Rotary to help us because we know clubs like Rotary have high quality volunteers that can help with many of the non-medical tasks. For example, when people come, they'll need to fill in a form, or they could get a form in advance and bring a form. We need someone to collect the form, look at it to make sure that it's completely filled in and that the handwriting is legible. Because what we do is we package these forms and we send them to New Jersey to be hand keyed in. And if they can't read them, or if the information is complete, then it delays what we're able to do and able to bill for. And of course, we need to bill because we need the money so we can do more flu vaccines. So we need someone. It doesn't take medical expertise. It just takes someone has the people skills, because some people really struggle with reading in Arkansas and filling out forms, and they may need some assistance, and they shouldn't be embarrassed about that. So they need someone who can help them with that. We also need someone who can help with traffic or car flow or many other tasks, so that the nurses and the staff at the health department who need to do the things that they're trained to do can do. And of course, we're all going to do social distancing, and those things will be observed. So it'll be a safe environment to volunteer in. So clubs that are interested in this, what I would like to do is ask you to contact the local health unit in your county, and I'm going to show you how to find the local health unit. So you just go up here on the website, it says health units, and you click on it, and you'll get a list for every county of the local health unit. And let's say Clay County in Corning, it'll tell you where it is, but it will also tell you the name of the administrator, that's the top person at the health department, and the phone number. And you can contact them and say, hey, I'm here with Rotary, and we want to assist with your flu clinics starting later in September. And you work out a way that makes it work for them, and it makes it work for your club members. I think this is going to be really important this year. Of course, we in Rotary know how important immunizations are, and I hope you heard the exciting news that came out on Monday that Africa is now declared polio free. And I just crack up thinking about it, because Nigeria came off the list of the countries where wild polio was still persisting. And I just think it's so awesome. So we in Rotary know how important immunizations are. So, and the important thing, and this is like my real ulterior motive for asking Rotary and service clubs to help our local health units, is because sometime later this fall, probably in November or later, we may receive our first shipments of COVID-19 vaccine. It depends on how the safety and efficacy trials turn out, but we are preparing in case they go well and vaccine is available. And we will be delivering this vaccine likely in much the same way that we do our flu vaccine. So if you have volunteered with helping with the flu vaccine, that's like a practice run for helping the health department provide COVID-19 vaccine. We'll only have a small amount in the beginning, but after the first of the year, we may have more COVID vaccine come out that we will want to provide to the people in Arkansas that wish to get it. And so this is, in a sense, a prep for the coming months in which COVID-19 is likely to become available. And so just a little bit about this. Is not the greatest slide. And I think if you want me to, my next update will be about COVID-19 vaccine, so people can get ready for what may be coming. But typically, when we develop a vaccine, it takes some time to find a good vaccine candidate, something that's going to work. And we go through phase 1, phase 2, phase 3 trials. And then after the phase 3 trials, if they're successful, then it gets licensed by the FDA. And during this time, the vaccine manufacturer is preparing vaccine for use in the trials. And of course, they may make 30 or 40 or 50,000 doses. But after it's licensed, they start ramping up to make lots and lots of vaccine. And any of you that got the recent Shingrix or shingles vaccine that came out and had to wait for it, understand that it takes time for the manufacturer to ramp up their manufacturing. And so in the beginning, there's kind of a shortage because the supply is not there, although the demand might be. Well, now what we've done during the pandemic is they're working on the safety and efficacy studies, doing some parts simultaneously. And even before they're finished and licensed by the FDA, the manufacturers are already making millions of doses. And of course, this is a huge financial risk, because if it does not get approved, then these doses that are made in advance will have to be discarded. But that helps us understand, though, why we can have all these doses ready so soon after the trials are completed, is because they're taking this huge risk to make them available. So we want to be ready when the vaccine is here, and we will need your help to make that possible. So, and that brings me to like my final slide. So, you know, it will be a while before we are on the other side of the pandemic. It may be a year or more. And I think if we know what we're dealing with, it's easier for us to deal with it. So we need to accept the fact that for at least the next year, we will be heavily involved in dealing with this pandemic. So I liken it to us being on a train. We will eventually get to where we're going, but it will be a long train ride. There will be twists and turns, ups and downs, but we have got to keep the train on the tracks, and we really need to help our fellow passengers on this train. So with that, I'm going to stop and ask for your questions and comments. And we can also stop sharing the slides.
Dr. Jennifer Dillahay with the Arkansas Department of Health, taking your questions, and, you know, some sobering information, a bit of reality, if you will, Dr. Dillahay. And I think it's important to put it in context that this is something that is not the typical flu season, cold season, that this is going to be with us for a little bit, and we just need to make sure, like as you mentioned, keep the train on the tracks. And taking your questions as it pertains to in-person meetings and working on those service projects. And you threw out a great example for a great service project that maybe a Rotary and other civic organizations need to take on. I'm going to start with some questions we have in here. This is Steve Massey in Batesville. We see various stats, active cases per 1,000, new daily cases per 100,000, the positive test percentage, infection rate. And what he's really getting at is, as you look through all of these numbers, you're the infectious disease specialist for the state of Arkansas. As someone is looking through the numbers in their community, what numbers should they be looking at when it comes to how safe it is to do in-person meetings?
Well, we get asked that question a lot, and it's a really hard question to answer. What you want to know is basically, is there a lot of spread in your community? And I like the way that the Arkansas Center for Health Improvement, AKAI, has done it. They have taken the school districts, so you kind of get, so if your club meets within a certain geographic area of a school district, that gives you the local spread. And they have divided into, I think, 5 different categories. So I would say that if you're in the highest one, which I think is 50 per 10,000, I wouldn't meet in person. And then you could think about the lower one. If you have in your group a fair percentage of people who are retired, over 65, or have health conditions, then even that second highest category, I would consider not having meetings in that setting. Does that help? I hope.
Yeah, it makes a lot of sense. And, another, just taking some questions here. Michelle Oglesby, good to have you with us this afternoon, Michelle. Considering having our annual foundation celebration, what are your thoughts about 60 to 80 guests? The venue will be very large and will be set up for social distancing. And I believe Michelle is in Little Rock.
Yeah. The health department doesn't really have an official recommendation on this. If you have a group of over 100, you should submit a plan to the health department for review, but this would be under 100. But you really need to look at the guidances for those kinds of events that we've put out there. I would not have such an event this fall. I just wouldn't do it and have flu on the horizon also. I think the risk is not worth the benefit.
A whole risk and reward.
Mm-hmm.
And Michelle is in Sherwood. Thank you for correcting me there. Going to jump to my next question here from Lori Diffie. If you're standing next to someone, I guess this can be anywhere. If you're standing next to someone, maybe at a meeting, who might be less than 6 feet away from you, what's the risk and how long should you stand near that person before taking a step back?
Okay. So that kind of risk is hard to gauge. But in general, we say that if someone is within 6 feet of an active case, someone who's got active illness, for 15 minutes or more, for a total of 15 minutes, then they need to quarantine. So what you want to do is set up your meetings in such a way that if it turns out later on after the meeting, you find out someone in that meeting tested positive, people in the meeting don't need to quarantine. You don't have to quarantine the whole group. That could be very disruptive to a lot of people's lives. So you want to set up your interactions at these meetings in such a way that the people that you interact with, if they turn positive, you don't have to quarantine. Or if you turn positive, you don't put them in a position of having to quarantine. So it's the 6 feet within 6 feet for 15 minutes more. That's our rule of thumb.
Robert Frazier, Jennifer, is it still thought incubation period is 14 days? Is it possible to show symptoms after 2-3 days?
Yes. So the 14 days it can be as long, but typically it's shorter. So the average day seems to be about 5 days after someone has been exposed and then infected that they'll develop symptoms. But it's important for people to know that when a person starts developing symptoms, that's because their immune system has kicked in, and it's the immune system fighting the virus that causes the symptoms. So that virus has been infected in them, in their nose and passages and throat and so forth, and has been multiplying itself. So they are actually giving off that virus in their puffs of air with the droplets in it for a couple of days before they have symptoms. So when we talk to a case, we try to find out when their symptoms first started, and then we go back a couple of days, and that's the infectious period. 14 days is the incubation period. Usually someone will develop illness within 14 days after infection. So that's why we ask people to quarantine for 14 days after they've been exposed, so that if they develop illness during that period of time, they are not exposing people. And that's how you break the chain of transmission. Now, it has been reported that people will develop illness beyond 14 days, and that can happen. It's been documented. But we feel that overall 14 days is a sufficient length of time, and that people may have symptoms before then. If they have symptoms, in fact, anyone that's a close contact can get tested during quarantine to see if they have developed the disease. Even if they're negative, they need to complete the quarantine period because they could develop illness after they get tested. But that gives you an indication of whether this person is sick. Some people will be asymptomatic. And if it is positive, then they become a case and you trace their contacts. So we do recommend 14 days still, even if people get tested and they're negative.
Beginning to get some comments about with it being an airborne illness and filters, UV light. Ron Dowda, I believe in Helena, West Helena, asked several questions, but one is on hospitals use UV lights to sanitize. Why is it not promoted more for homes and businesses? And I did get another question from someone else asking about better filters than what we see in our homes. Any thoughts or recommendations on either of those?
Aerosol does play a role in this transmission, and it may be greater than we realize. It doesn't seem to be as great as other illnesses like tuberculosis or measles, but it does play a role. So good air filtration is good, but it's not so much filtration that you need as air exchange. So you want fresh air coming in to dilute the virus that's there. So in a home, if you can get good air exchange, of course, if you're living in the home and not having the virus introduced all the time, that's a benefit. If you limit who comes into your home, that can help. UV light has not been promoted in home settings because of the risk of UV light. So it can cause damage to eyes, to skin, and so forth. So it has to be offered in a very controlled way. Some hospitals do UV light as a way of addressing airborne or aerosolized infection, mostly tuberculosis. And they'll have it in special rooms in case where they put suspected patients with TB. But it's really in hospitals, they depend more on air exchange than they do the UV lights. And they actually have methods for calculating their air exchange and making sure that there's a certain amount of turnover per hour. And it's measured and addressed if it's not sufficient in the hospital.
This is a question that I candidly have not thought about, but it makes a lot of sense. Gloria is asking, is there any reason to have any concern about a handheld thermometer being repeatedly pointed in close proximity to someone's pituitary gland, as she mentions, but just someone's forehead or repeatedly being put next to someone? Is there any risk of any transmission from that, even though it's touchless?
Hopefully it's the same person doing the thing. Although I have to admit, sometimes they'll leave it down and expect people to pick it up and do it. And I'm not sure that's a good idea. I haven't seen anything that would lead me to think that there's a problem in terms of penetration past the skull into the brain to affect the brain. I would be shocked if there was that kind of penetration by something that reads the heat off a face.
Question here, and I'm going to transition a little bit away from our discussion, but I think it's irrelevant. From Ron Dowda, he is asking, do you have any information about the new 15-minute test? Mentioned some companies there. And I guess the quick test versus the traditional longer to get back test. Where are we at in terms of testing in the state, and are the the quality improving? Are you growing with more confidence in the quick turnaround tests versus
Yeah.
a traditional one?
Okay, well, let me just talk about tests in general. So right now, readily available are three kinds of tests. There's the PCR test, which stands for polymerase chain reaction. That's the one that came out first, and it's the most accurate. It's the gold standard that all the other tests compare themselves to. And it uses a sample from the nasal pharynx way in the back, or nowadays that you can use a little swab that you just put up in your nose about an inch and collect a sample. And it looks for the genetic material of the virus. So if it can find it, then you know you have that virus present. And it's pretty good at picking up the virus when it's really there. And it's pretty good at being negative when it's really not there. Then other tests that we have that's called a point of care test or a rapid test it's available in pharmacies and some clinics and now some of the health department local health units is an antigen test. And you collect the sample the same way with the sample from the nose, from inside the nose. And they run that test and it takes about 15 minutes to run it. You can only do one sample at a time, but you can wait and get an answer right away. And it looks for the proteins on the virus. And if it finds it, then it's present. And that's a good thing. But these antigen tests are really designed to work for on people who have symptoms that are likely to have COVID-19, and then you can confirm that's what it is and not some other respiratory virus. And if it's negative and a person really has symptoms, then it's recommended that a second sample be taken and that one sent for PCR, because sometimes it misses it when the virus is really there and the PCR will pick it up. Anyone who gets the test needs to isolate until you get the result. You don't want to be running around like the PCR test. It may take 2 or 3 days to get the result. You don't want to be running around the community spreading the virus if you have it and think, oh, darn, I should have isolated. Isolate and then get your results. And then you can decide what to do. There is an antibody test, which is a blood test. And that shows whether you've had an immune response. And that is not useful for making decisions about whether you have it right now or not, because it doesn't turn positive till you've gotten well. So that's helpful in understanding, if you do a lot of people, how it has spread in the community. There are new tests available, the Abbott one, which has just been approved. And I haven't learned that much about it, but it can do a very quick test. And the method that you do it is kind of like a pregnancy test. And I think if they're inexpensive and people can take them and use them at home, I think that will revolutionize how we monitor ourselves for this virus and then can take steps to address it. One of the issues we're having is that people are getting the antigen test and they're positive, and then they decide they're not going to do anything about it because they're not particularly sick. And we're actually having this problem on some college campuses. The students don't want to get their friends in trouble and make them quarantine, so they don't do anything. And then they just don't break the chain of transmission. So if we're going to do these tests, we need to abide by the results. A lot of people want to get around the requirements for isolation or quarantine, and people can outsmart the requirements, but they can't outsmart the virus. So we have really got to take this seriously.
Absolutely. Dr. Jennifer Dillahay with the Arkansas Department of Health, the infectious disease specialist for the state of Arkansas. A couple more questions here. Mm-hmm. Lori Monday asking, does it seem like enough time to really tell the effects of the COVID vaccine? What are your advice for people against getting this vaccine?
Well, first of all, it's not just one vaccine. So, people need to take into consideration the different vaccines and its characteristics. My take on the situation is that the safety and efficacy studies will be done well. The manufacturers will submit the necessary studies to the FDA. It will be reviewed, and if given approval, it will be reviewed by the Advisory Committee on Immunization Practices, which is the group that advises the CDC on what vaccines should be recommended in the U.S., how many doses and what ages and so forth. And I happen to know one of the people on that committee. It's Dr. Jose Romero, which is the Arkansas Secretary of Health. He's chair of that committee. And I really do not have any doubt that they will toe the line when it comes to making sure that this vaccine is safe and effective, and whatever vaccine they approve. Now, getting that message across to people is really important. But of course, as with any new vaccine or any new pharmaceutical, because there may be rare effects or adverse effects of that vaccine, we will be monitoring that closely through the Vaccine Adverse Event Reporting System, VAERS, so that if anything turns up, it can be immediately looked into. And we had a new vaccine several years ago for rotavirus, which is a vaccine for children. And they did pick up, after they had gone through the safety studies, that there was a rare side effect. And they were able then to do the statistical analysis and verify it, and they pulled that vaccine. And I do not have any doubt that they would do that again. But from what I'm learning about the vaccines, I'm feeling much more comfortable that if they're shown to be effective, that they're going to be safe. It's, to me, I'm more concerned about whether they're really going to work.
Dr. Jennifer Dillahay, epidemiologist with the Arkansas Department of Health, thank you for joining us and your insight from not only a fellow Rotarian, but for all civic groups across the state of Arkansas. Appreciate your time.
Thank you very much. I hope this has been helpful. And if you want me to do it again, I'll be happy to spend more time on the vaccines.
Absolutely. And we appreciate everybody watching and for joining us, asking questions, and everything that you do for your communities across Arkansas. Before we go, as Dr. Dillahay mentioned, if you have a topic for a future conversation, or if you'd like to hear from another expert in another field, let us know. We're looking to do this again. You can type your ideas in the live chat window. Notice someone mentioned that they joined late and they wanted to see some of the slides again. This presentation is being recorded, so if you're watching on Facebook Live or YouTube, you can go back and watch again and catch up on the presentation. So thank you for joining us. This has been a special presentation by the Rotary Clubs of Jonesboro and West Little Rock. Thanks for joining us. Stay safe and healthy.